Today's story is sponsored by Tidelands Health.
Oh, there's something so real about living local, about the people and the places where we live. Just look at all the reasons why we call this home. And I'm loving living local. I'm living local 'cause it's where I love to be.
Good morning. Thanks so much for watching Living Local. Today we are at Tidelands Health Breast Center, and it is October, so it's Breast Cancer Awareness Month, and we are chatting with Dr. Craig Brackett and Heather Gainey. How are you two doing today?
Great.
Great.
Thanks for having us.
Yeah, thanks for having me. So Heather, we're kind of putting a spotlight on you today because you have a very exciting story because you are a breast cancer survivor. Congratulations.
Thank you.
Very exciting. So part of this journey, is going to really help other people who may have to walk this journey later. So do you mind kind of telling me your story and how you found out and all that good stuff?
Sure. Several months before I actually made an appointment, I noticed some changes in my breast. For a bit of a time there, I thought that everything was okay. Things changed a bit in February of last year. So I made an appointment to have a mammogram. Actually, it was time to have a mammogram,
Sure.
Thankfully.
When you say things were changing, what does that mean? Like you noticed a change?
I had a very dense, hard area
Okay.
that I found prior to my mammogram in my left breast.
Okay.
Things went really quickly after that. I had an ultrasound and then met Dr. Brackett, and we quickly realized that things were not good, and we had to come up with a good plan, in which we did.
Is that customary of?
Yes.
So if you have a palpable mass, then you should always get an ultrasound.
Okay.
So she had a palpable mass in her breast, so they did an ultrasound. She came to see me, and we did an ultrasound-guided biopsy to,
Right.
Diagnose the cancer.
Okay. So once you saw that it was cancerous, what happens? Do you get together and you talk about what's going to happen, the best treatment, or how does that work?
We sent it off to our pathologist, Dr. Steve Valerie, who's outstanding, and to figure out the type of cancer it is. And then once we know the type of cancer it is, then we do a workup. So frequently that'll include an MRI or PET CT or additional imaging based on the patient's presentation. And so in this case, she had a pretty aggressive tumor. And so that's when we got our medical oncologist involved up front to use chemotherapy before the surgery to help things move along.
Sure.
and help make the tumor go away.
Now, Heather, we were kind of chatting before we started rolling, and you were saying, well, I almost missed it. This was something that I almost didn't really bring up. What did you mean by that?
Well, in some regards, I thought that it was just somewhat normal for my breast to feel that way.
Yeah.
And I think that is a misconception, a huge misconception. I think we're all taught of exactly how it will feel when your breasts change, and I don't think that's quite accurate.
Sure.
I guess it can. I think if there are any changes in your breast, it's
You should get it checked out.
worthy of concern and having it looked at.
In her case, what we did was called neoadjuvant chemotherapy. And that's where we give chemotherapy before we do surgery.
Okay.
And there are very specific subtypes of breast cancer that we do that for. And there are multiple benefits. The most important benefit really is if you do the chemo up front, and by the time you get to surgery, all the cancer cells are gone. That tells us that the patient is going to do really well. And otherwise, if you do surgery up front and then give them the chemotherapy, well, you don't even know if the chemo works.
Sure.
So in Heather's case, we gave chemo up front. We went in there, we got what's called a pathological complete response, meaning the cancerous lymph node was no longer cancerous and the tumor in the breast was completely gone.
Wow.
And so that's a very powerful
Very fortunate.
indication that this patient may do better. To do that, you have to have a team and have a multidisciplinary approach to it, and which is what we do here. And it's an individualized, tailored approach for each patient and her type of cancer.
Right.
And I can't say that enough. It's really important to look at each individual's cancer. And though she had an aggressive cancer, she had one that we could treat.
There was never a doubt or never a thought that this wasn't something that I would get beyond and get past, and now be able to share and discuss and
help others.
And help others.
absolutely.
Well, thank you for sharing your story with us today.
so glad to. Thank you for having me.
Yeah, and I know they're all,
We're
every
gonna break
case
the
is
rules and we
different,
can do
right?
this right.
Oh, he said we're breaking the rules, the COVID rules.
Some
I think
rules.
you guys have earned it, right?
Yeah.
You've been around
we
each
have.
other
Yes, we
enough.
have. Yeah.
Yes, we have.
Well, perfect. Well,
Thank you
folks,
so
if you
much.
want to schedule your mammogram or find out more information, you can visit the information on your screen. Thank you guys as well for watching Living Local. We'll be right back.
Today's story is sponsored by Tidelands Health.